And while some people get homesick during the holidays, others just get sick the old-fashioned way. And medical experts warn the flu, RSV, COVID, and other viruses are looking to put a damper on your family time this holiday season. To learn more about what you should be cautious of and what you can do if you get sick, well, we've got a doctor's opinion for you. Take a look. Here to talk about some of the stuff that goes around during the holidays is Dr. Corey Smith. Dr. Smith, thank you so much for being here with us.
Good morning. Thank you.
Good morning. So, doctor, tell us, why is it that, a majority of people get sick more oftentimes during the holiday season?
Well, like I said, 'tis the season, right? This is the season that the kids are back out of school. All the family and friends are getting together. We're in the crowded airports. The stress level is up as we prepare for these holiday meals. And of course, with that stress level being up, the immune system gets a whack in the side. With that being said, a runny nose, the cough, colds, flus, influenza, and of course that word COVID shows up in our homes.
So what illnesses are we seeing more often? I know you said that it's flu season. Is it just a case of the sniffles, or is there other things we should be on the lookout for?
No. So yes, it's flu season. This is throughout the United States. We're seeing more flu, influenza, another word for flu, COVID, our sore throats, our runny nose, and the body aches that come with that.
Wow. So COVID definitely is still something that we need to keep on our radar.
Yes, unfortunately. Yes, it is.
And doctor, nowadays you can receive health care without even having to leave your home, which is very convenient during this holiday season. Tell us about Teladoc and how it is able to benefit patients.
Well, I love that. Just as we are purchasing items, at the tip of our fingers from our phone, we can actually access healthcare at the tip of our fingers or our tablets also. So Teladoc Health, we are a large multi-specialty company with dermatology, nutrition, primary care, and of course, what I represent, the virtual urgent care space, where we can actually access patients and meet them where they are. So whether they're rural America or if they are in the big cities and having urgent care around the corner, when we feel that you're just not feeling well enough to get out of your home, we can meet you where you are and see you and treat you with physician and nurse practitioners from your phone.
And can you give me just like a runaround of how these symptoms are being diagnosed?
Absolutely. So the nice thing is whether via phone or virtually using video, just like we're meeting, we have our physicians and our nurse practitioners that are listening and treating you using sometimes that word again, AI, but also using our diagnosis skills through pictures and video visits and listening to that individual symptoms. So whether it's a sore throat, a body ache, a fever, chills, or the upset stomach, we can take care of all your healthcare needs.
So let's say I have a sore throat. I got some stuff, going on back there. Well, could I possibly would that be through a photo or getting my throat in the camera and showing you all the ickiness that's going on? How does that work?
Believe it or not, all of the above. So we can get really fancy and use a little medical jargon, which I won't. There's things like Centaur criteria from asking specific questions about what symptoms you're having, whether you're having the spots on the back of your throat, which we call exudates. And believe it or not, with technology, we can actually see the back of your throat, whether it's from your camera or different AI devices, and we can accurately diagnose what's going on.
I definitely like this idea. A lot of us tend to, stray away from doctor's office just because the anxiety that people get being in the waiting room. Is there anything else that our viewers need to know about these services that you'd like to add?
First of all, there's no way you're scared of me. I'm not scary. Not even my kids are scared of me. But all seriousness, we offer many different services. So again, whether it's your acute needs like the virtual urgent care, or it's the preventive care, because again, the prevention is the biggest tool to successful and happy and healthy lives. We have our primary care, nutrition, dermatology. We have expert medical services where we can go and get a second opinion. We have mental health, whether it's from your therapist and or a psychiatrist. So we have all of these integrated specialties within our system to coordinate your healthcare, again, from your home, from your work, or, whether in your car.
Dr. Corey Smith, thank you for being here with us this morning.
I appreciate you. Happy holidays, everyone.